Dr. Jeff Watson, just wanted to cover today, what are the expectations after deciding that you or one of your patients is going to have surgery? So after a patient has visited me in the office and we've made a joint decision that the patient is going to advance with the surgical procedure, I will have answered all of the patient's questions and then asked the patient, have I answered all of your questions regarding the surgery? Once the patient says, yes, I would like to move forward with surgery, we put together a surgical booking sheet and schedule the patient for a procedure, generally within a handful of days and no more than about 2 weeks. In fact, I generally have to see every patient within 30 days to qualify them for surgery. So if a patient does want to schedule out in the future, say 45 days from the time that we're talking, then they would have to come back to the office to be seen again so that we see them within the 30-day window. That's typically a rule for both hospitals and for surgery centers. Once a patient has decided on the date of surgery, we will meet together on the morning of surgery and I will do an informed consent, which is to go over the procedure and discuss what we're going to do again in detail. We'll put down the exact procedure on paper so that both the patient and I will sign to the same consent with the same procedure on it. We'll then take a marking pen and then mark the exact body part that we're working on. So if the patient is having a right shoulder arthroscopy, it will get a purple mark on the right shoulder that declares that's the side that we're performing surgery on. The surgery will go very quickly for the patient after they see the anesthesiologist. Then a lot of times patients don't recall much until they have gotten home. The patient is not awake during the procedure unless it's a certain type of procedure. Generally, they don't remember initially waking up after surgery and sometimes don't remember seeing me or family members after the procedure. Because of this problem with not recalling details, we generally don't have an in-depth conversation after the procedure. I will see the family member or a staff member will see the family member. We will convey that the surgery went well and that you are healthy, but I will not spend a significant amount of time with the patient post-anesthesia to review what happened or the details. We will call you on post-operative day number 1 to make sure that any instructions or questions you have are answered. After the surgery, there is an attempt by the nursing staff to go over the details, so they'll provide you some instructions for after surgery. They'll provide you with the script for your pain medications and just general instructions. For example, if you're non-weight bearing, you'll use crutches or remain in your sling if you've had a shoulder surgery. We also generally try to get you quickly off of pain medications, so the medicines that you're given are only for a handful of days. State of Florida is very restrictive and does not generally allow us to prescribe multiple opioid scripts. Because we understand patients continue to be in pain, even sometimes after we're not allowed to give you opioids, we typically will provide another medication, usually an anti-inflammatory. Some patients will prefer standard anti-inflammatories such as ibuprofen. Others have moved more towards another type of medication like CBD. After you've taken your medications in the post-operative period, you will generally go off of those once you feel they're not necessary. I will see you back in the office 2 weeks after your procedure, and a lot of times patients have either stopped taking medications altogether or dwindling down on the amount of medications that they're taking. In the pain management process between your surgery and 2 weeks when we see you back in the clinic, ice, elevation, and a lot of other strategies are just as effective as medications, so we'll go over some of those with you after your procedure. What I can tell you in general is that ice has been shown in multiple studies to be quite effective, and that's the number one that I would recommend after surgery other than the medications. Once you come back at the 2-week follow-up, that's usually when we talk about your recovery and your rehab. Some patients at 2 weeks will be ready to go into physical therapy. Other patients will still require some period of prolonged immobilization or non-weight bearing and use of crutches. Once we've had that 2-week visit, you'll have a plan moving forward and have a good sense of when you're going to start your rehab program. Typically from there, you will do rehabilitation for anywhere from a few weeks to several months, depending on the severity of the injury. We'll be with you each step of the way and have protocols for your therapist to follow along to get you from the immediate post-surgical phase all the way until you've recovered fully. Please feel free to contact us, and we hope we can be of assistance to you and your patients.